Hello and welcome to this morning's Senior Resource Town Hall. My name is Adam Veal and I'm a Deputy Communications Director for Congresswoman McBath in her Sandy Springs District Office. We've convened today's conversation to talk about two resources to protect the health and safety of seniors through fraud prevention and Medicare health benefits. We're joined by experts from AARP and the Centers for Medicare and Medicaid Services. At any time during this morning's event that you wish to ask a question, please press *3. And if you'd like to subscribe to the Congresswoman's newsletter, please press *6. And now it is my pleasure to introduce Congresswoman Lucy McBath.
Thank you so much, Adam. And good morning, everyone. And thank you so much for joining us this morning. And I'm thankful that we've had this opportunity to be together. And while I know that Thanksgiving holiday last week may have looked a little different than in years past, I hope that you were able to relax, connect with your friends and family safely, and reflect on the things that you truly are grateful for. And we do still have much to be grateful for. And one of the things that I'm most grateful for is the opportunity to represent you, the people of Georgia's 6th District. To be able to represent you in Congress is completely an honor for me. It's an extraordinary privilege to represent your priorities and your concerns in Washington. And I'm humbled by the opportunity to continue that work over the next few years. And while this year has given us no shortage of challenges and obstacles to overcome, I believe that we can continue to work together to solve the problems that are facing our community and to work to usher in a bright future for our families and our loved ones. Opportunities like the one that we have at this moment, the one that we have today, moments like this are such a wonderful tool for me to hear your concerns and also to share resources that hopefully bring some value and peace of mind to you. Before we begin our conversation today, I also wanted to remind you all to continue to take care of yourselves physically and mentally as we head into the holiday season. I know for myself, sometimes the holiday season is a little difficult. Thanksgiving a little bit more difficult than Christmas for me because Thanksgiving is the time that I lost my son. But it's critical that we all continue to listen to our public health experts like those at the CDC to follow all the recommended guidelines. Please continue to physically distance when possible and wear your mask when you're actually going to be in public. Please wear your mask. And I want to encourage you to take care of your mental health too. Check in on your families, your friends, and your neighbors. And, the holidays can be very difficult times for people, even under the most ordinary of circumstances. And I know that this year has been anything but ordinary for all of us. It's so important that we take good care of ourselves and recognize the importance of physical and our mental health. I also want to offer my ongoing condolences to those of you who are grieving for a friend or family member who has passed away due to coronavirus. And my prayers will always be with those who are hurting today, and I do often pray over our entire community. I wanted to convene today's conversation to focus on our seniors and make sure that those throughout Georgia's 6th District were equipped with helpful information about how to manage their health benefits through Medicare. Whether you have questions about your existing benefits or you're preparing to enroll for the very first time, today's conversation will provide insight into the benefits that you may be eligible for as a senior. And in just a moment, I will introduce a great guest speaker from the Centers for Medicare and Medicaid Services who will address this topic with you. Unfortunately, the holidays are also a time when scam artists and fraudsters increase predatory activity aimed at seniors. So we are also going to hear from a speaker at the AARP about best practices and tips for our seniors and their loved ones to stay safe from scams and fraudulent activity. Today, I am joined by an expert with CMS, Sherrod Mackey, and Sherrod is the Acting Regional Administrator for CMS in the Atlanta Regional Office. We also have Seth Bosley, Advisor for Fraud Prevention Programs for the AARP, and Hillary Thomas, who's the Associate State Director of Advocacy and outreach for the AARP Georgia State Office. I want to thank Sherrod, Seth, and Hillary for lending their expertise to this event today and for all the work that they're doing to continue serving our constituents during these times, especially these most difficult times. And in just a moment, I'm going to turn things over to Seth for an introduction, and then he will begin actually his presentation at that time. Then we'll hear from Mr. Mackey and also CMS. And following our guest presentations, please stick around for a question and answer session that we're going to have. Many of you actually submitted questions when you registered for the event. And my staff will also be screening questions during today's conversation. And at any point, if you have a question that you would like to ask, just please dial *3. We want to make sure that we get to as many of your questions as possible. But if you'd like to subscribe to my congressional newsletter, please press *6. Again, thank you so much, all of you, for being with us this morning. At this time, I'd like to hand things over to Seth Boffelli. Seth, thank you so much, and take it away.
Thank you, Congresswoman, and thank you for the opportunity to speak to your constituents today. AARP's Fraud Watch Network is active in all 50 states, but very active in Georgia as well. And we're really focused on two main things, helping victims of fraud and also providing consumer education. We have a nationwide helpline for victims who have lost money or who have been targeted by scammers. Every year we help over about 100,000 victims try to get their lives back together. But through our state offices, where my colleague Hillary is based in Atlanta, we are providing a lot of consumer tips. And that's really important because our research has shown that if you know about a scam ahead of time, you're 80% less likely to engage in it. And if you don't engage in it, then you don't fall victim to it. So this consumer education mission is really important because we know that scammers are targeting older Americans. You know, everybody is, of all ages really, are being targeted by scammers, but seniors have a lifetime of savings, and so, you know, if you ask bank robbers why they rob banks, they say it's where the money is. And so scammers are looking at seniors because they know that we've saved assets and that there's money available. Right now it's the holiday season, and so most of the scams we're seeing are related to holiday shopping. And so I just want to go through some of the common ones we're seeing and talk about what are some tips to keep yourself safe. As the Congresswoman mentioned, the coronavirus has really changed our lives in a lot of different ways. And one thing that we saw in a recent survey is that about 3/4, about 73% of the people we talk to are using the internet for essential business. It's a part of their everyday life now. And one way that is really moved into the forefront is through online shopping. And that's something that scammers are taking note of. And so more and more people are being targeted with fake shopping scams. The way that they usually show up is through an email or a fake website or an online or potentially a social media ad that typically offers a discount that's, you know, too good to be true. And so when you click on that link, a lot of times you're taken to a website that looks legitimate. It might even have the logos of a trusted retailer, but in some instances, it's completely fake. It's been created by a scammer, and when you enter your information, you're going to be taken advantage of. So let's just go through 3 kind of common scams we see around the holiday season and we're seeing right now. The first is that fake product website. And so you'll get an email or you'll see an ad that you'll click on, and it'll take you to something that looks legitimate. And maybe it offers you that gaming system that you can't find anywhere else, or maybe it offers you, 60% off, whereas the regular retailers are only offering 20% off. So it's very tempting. It's offering something that's either unavailable or something that is a price you can't find somewhere else. More often than not with these sites, once you enter your payment information and click send or submit, you're charged, but your product doesn't show up. Sometimes you get the product, but it's a counterfeit knockoff, but more often than not, these are just no shipping sites, so you're paying for something that's never going to arrive. This has really been fueled by the pandemic and by coronavirus. In the spring, we were seeing lots of these scams around Clorox wipes or around masks or test kits. So things that whenever there's a scarcity, you'll find scammers will offer something up that's not really there. So how can we stop it? So first thing is look for, if you're ever paying for something, what you want to do is on that URL, on that web address, the first thing you should see is HTTP, and it needs to have an S on it, so HTTPS. That S means it's a secure site. You also might see a little padlock icon. That means that your payment information is going to a secure site and it can be trusted. Scammers don't have that, so that's a first telltale sign. Look for that S and that HTTPS. The other thing is, say you get an email from a retailer that you trust, and it shows a remarkable discount. You typically anything over 55% off should be suspect. But say you get an email that says 75% off this must-have item. Go to, you trust the retailer, and so you want to get this. Well, instead of going to that link, go online and search up that retailer's regular website. And go to their regular website that you find or that you're used to going to. If you can find that same discount there, then it's legitimate. But don't trust the link that shows up in your email or shows up on that web address. And then also, don't pay by wire transfer or money order or gift card. So sometimes these scammers will ask you to pay somewhere other than what you typically pay with a credit card. With a credit card, if you fall victim to a scammer, you can always go to your credit card company and refute that charge, say you were taken advantage of, and then their fraud prevention teams kick in and that charge is taken off your account. If you're using a debit card, if you go get a gift card and send that, or a money order, that's money that you can't get back unless they find that scammer, which is really hard to do. Another scam we see a lot of in the holiday season, and this is kind of unfortunate, but it's popular, pet scams. So, everybody wants that Hallmark moment when your kid or your grandkid opens up the present and there's a puppy or a kitten inside. And so pet adoption is really popular around the holidays. And again, scammers are always following trends. And so there are a lot of bogus pet adoption websites on the internet. And so actually, according to the Better Business Bureau, about 70% of people who are targeted by pet scams end up losing money, and they typically lose $500 to $600. So what do we look out for, and how can we stop it? Well, first of all, these online, the fake online pet scams will always have a barrier that won't let you to actually see the pet in person. So either they'll be far away or there'll be some reason that you can't come and pick up the pet, but they need to ship it to you. So that's one red flag to look out for. The other red flag, again, is the common theme on shopping scams are deep discounts. So this is half off what you can get a dog or a cat in your area, which is tempting, but that's the trick that they use to try to lure people in. And then the other thing how this scam usually works is there's lots of things that you have to prepay for. So you have to prepay for vaccinations, and then after you pay for that, then there's an exam that needs to happen. And then after you pay for that, then there's shipping that has to happen. So this is how they really kind of nickel and dime you. And then by the time you actually expect your dog or cat to show up, it doesn't. And now not only are you out a lot of money, you're heartbroken, because this animal that you were looking for yourself or your loved one is not real. So that's one thing that unfortunately we see a lot. If you're looking for a pet this holiday season, find a local option, find a place where you can go in and pick the dog or the cat out in person. That's where you know you're going to be the most safe and the most secure. And then the third scam we see a lot around this time are around gift cards and essentially getting a gift card that doesn't have any funds on it. Our research has showed that about a third of people we contacted had reported buying or receiving a gift card that didn't have any funds on it. And this is kind of an old-fashioned scam. Basically, that code on the back that is the key to unlocking the payment on the card. Scammers will come through and basically just scratch that code off and get it, and then cash that card in before it's actually sold. So the kind of best practices for not falling victim to that is, first, one thing, if you're going to use those racks you see in a lot of stores, try not to buy the first card on the rack, because that's the easiest for a scammer to get a hold of. So reach to the back, pull one off the back. That's a good tactic. The other thing is just to avoid those racks altogether. I know they're convenient. You see them in the grocery store where you go to shop. The safest way to do it is to go to the retailer directly and buy their gift card at the checkout. You'll usually see a kiosk right in the checkout aisle. Those are very hard to tamper with because you're right in front of the cashier. Or you can go online to any of these retailers and buy gift cards online. So that's those are some key ways to avoid another common holiday shopping scam we see. And in general, while we're talking about gift cards, I just want to say that gift cards have become one of the most popular ways for scammers to get money from their victims. So if anybody ever asks you to send them payment in the form of an iTunes gift card, an Amazon gift card, if anybody ever tells you that they need, you owe them $300 and the way to send them, to get it to them is through a gift card, you can almost be guaranteed that's a scam. And so that's a huge red flag to look out for. In avoiding paying by gift cards is an important tool to stopping scams in this country. So that's a really quick overview. Just really to finish, online shopping, it is convenient, especially during COVID. And I don't want to scare anybody from buying stuff online, but there's just some key tips to keep yourself safe. First of all, make sure that your computer or your phone, the operating systems are the latest antivirus software. That way, these links that you're getting sent aren't downloading malware onto your computer, on your phone. Don't trust social media ads that advertise prices that are too good to be true. Another thing we didn't really talk about, but an area that's really open for fraud are these peer-to-peer payment apps, so like Cash App or Zelle or Venmo. They're really intended to be used among friends. So if you're splitting a dinner check or sending somebody some money for your brother some money for a present for your parent, that's what they're intended for. They're not intended to be used to pay for goods and services. And the reason we don't want to really use them to pay for goods and services is that, again, they don't have any of the protections that your credit card has. So if you get taken advantage of through one of these apps and you want to get your money back, there's really not a whole lot of legal recourses for you to use. And the same thing is true for debit cards. If you use your debit card to pay for something that turns out to be fraudulent, that money is out of your checking account until you get it back. And so your debit card doesn't have the protections that your credit card has, where you can just call the number on the back of the card and report it as a fraudulent claim, and it gets taken off your bill. So With that, I don't want to take up too much time because I know we have some great questions on the line, so I'll just turn it back over.
Well, thank you so much, Seth. And now I'd like to hand things over to Sherrod from CMS. And Sherrod, you take it away.
Great. Thank you so much. Good morning, and thank you to Congresswoman McBath for this opportunity to speak with you. My name is Sherrod Mackey, and I'm the Regional Administrator for the Centers for Medicare and Medicaid Services, CMS Atlanta Regional Office. CMS Atlanta covers local engagements in the state of Georgia, Alabama, Mississippi, Kentucky, Tennessee, Florida, North Carolina, and South Carolina. I'd like to first remind the audience that Medicare Open Enrollment began on October the 15th, and it will run through next Monday, December the 7th. Every year, Medicare health plans change by cost, coverage, and participating providers. Even if you're happy with your current Medicare coverage, not all plans offer the same benefits. Comparing your current plan against other options can help to potentially find coverage that's a better fit for you or provides additional savings on prescriptions and other medical costs. There are several important things every person with Medicare needs to do before Medicare Open Enrollment ends on Monday. First, think about what matters most to you. Medicare health and drug plans change each year, and so can your health needs. For example, do you need a new primary care doctor? Does your network include specialists who you want for your upcoming surgery? Do your current plan covers your new medication? Does another plan offer the same coverage at a lower cost? Please take stock of your health status and determine if you need to make any changes. Second, think about what Medicare coverage is right for you. There are tools on Medicare.gov where you can preview 2021 health plans and drug plans, find out what health items and services are covered, or securely log into your MyMedicare.gov account. And third, shop for plans that meet your needs and fit your budget. Go to Medicare.gov to compare coverage options, prescription drug plans, and shop for either original Medicare or Medicare Advantage plans that meet your health needs. Remember, during open enrollment, you can decide to stay in original Medicare or join a Medicare Advantage plan. If you're already in a Medicare Advantage plan, you can switch back to original Medicare during open enrollment. Open enrollment is for all people with Medicare, and again, will run through Monday coming, December the 7th. This open enrollment, there's big news for people who take insulin and who are interested in Medicare Advantage plans. Hundreds of plans now have a $35 monthly copay for insulin. Open enrollment this year for Medicare beneficiaries that use insulin. This year, Medicare has worked to lower the out-of-pocket costs for people who need insulin. Please use our plan finder to help find a plan that participates in this innovative program, or call 1-800-MEDICARE to find either a Medicare Advantage plan with drug coverage or a Part B plan that offers insulin for a $35 a month copay. Seniors may be able to save on average 66% or $446 on insulin costs annually. For those whose health and even lives depend on insulin, these savings are wonderful. Plan premiums are at a historic low. The Medicare Advantage average monthly plan premium decreased 11% to $21 estimated in 2021, from an average of $23.63 in 2020. Since 2017, the average monthly Medicare Advantage premium has decreased by an estimated 34%. That's the lowest average monthly premium for Medicare Advantage since 2007. It's useful to consider a Medicare Advantage plan which offers coverage for things that are not covered by original Medicare, like vision, hearing, dental, and wellness programs, including gym memberships. Like last year, new Medicare Advantage benefits gave chronically ill patients the possible access to a broader range of services that are not necessarily health-related, but have a reasonable expectation of improving or maintaining health or overall function. For example, Beneficiaries enrolled in a Medicare Advantage plan could now receive transportation for non-medical needs like grocery shopping. For a patient with asthma, for example, a Medicare Advantage plan could cover home air cleaners and carpet shampooers to reduce irritants that may trigger an asthma attack. Health plans can change their offerings every year, so please shop around and compare plans that can pay off. You could save money, find extra benefits, or both. You can compare plans during open enrollment from the safety of your home. We recommend that you go to Medicare.gov to find plans. Enter the prescriptions you take, and it can show how much you will pay for them in every plan in your area. State health insurance assistance programs, which are known as SHIPs, assist Medicare beneficiaries, their families, and caregivers through objective research, counseling, and training to make informed Medicare decisions that optimize access to care and benefits. In particular, SHIPs help navigate the new Medicare Advantage and Part D plan options every fall during the open enrollment period and can assist you with enrollment decisions. All SHIPs are offering assistance virtually during the pandemic. They're also assisting through phone calls and web desk tools also. Here in Georgia, the local SHIP is Georgia Cares, and they can be reached at 866-552-4464. Again, Georgia Cares can be reached at 866-552-4464. To schedule a counseling session with a trained counselor, use option 4. Their website is www.mygeorgiacares.org. They can also be found on Facebook. They are offering a free Medicare webinar actually tonight from 6 to 7 p.m., and you can register on their website. The webinar is on Medicare Open Enrollment Period, the best decision for you. Again, their web address is www.mygeorgiacares.org, MyGeorgiacares.org. If you're not in Georgia, please contact your local SHIP, and you can find that information at www.shiptacenter.org. And if you need any additional assistance, please reach out to 1-800-MEDICARE. During the COVID-19 pandemic, you can compare plans easily from the safety of your home. Again, visit Medicare.gov, call 1-800-MEDICARE, or contact the local SHIP, Georgia Cares, at 866-552-4464. As we continue to fight the coronavirus, this year it's more important than ever for people with Medicare to get a flu shot to protect themselves and their families. People with Medicare are at greater risk for serious complications from flu. A flu shot is the best protection for getting and spreading this virus, and it's covered by Medicare at no cost. The flu vaccine prevented 4.4 million flu illnesses and 58,000 hospitalizations in 2018 and 2019. And this is an extremely important year for this. With COVID-19 circulating at the same time as the flu, we don't want to put added and unnecessary strain on our already burdened healthcare system. Flu season began in October, and it goes into April 2021. And December the 6th through the 12th is National Influenza Vaccination Week. It's always important to get a flu shot, but this year is even more important. The flu shot is 100% covered for people with Medicare, as long as they see a Medicare provider or a provider in their plan's network. That could be your doctor, a local pharmacy, or other places that give flu shots. While it can be, it can cause anxiety producing going out to public spaces, doctors' offices and pharmacies are taking precautions to keep you safe. Make sure you wear your mask and follow directions to social distance when getting your flu shot, and wash your hands regularly. You shouldn't put off your healthcare needs, especially in your managing a chronic health condition or need preventative care. Millions of Medicare beneficiaries have received a common office visit via telemedicine. The speed and effectiveness with which the American healthcare system has adapted to telemedicine is arguably the most important silver lining of the pandemic. Since mid-March, over 11 million beneficiaries have used telemedicine in traditional Medicare, an almost 6,000% increase from the prior 2.5 months. Nationwide, 34% of Medicare fee-for-service visits have occurred using telehealth. So please make sure to take care of your healthcare needs. In response to the public health emergency for COVID-19, we at CMS want to ensure you have affordable access to testing and treatment for COVID-19, including access to any FDA authorized or approved COVID-19 vaccine at no cost. Medicare Part B completely covers COVID-19 tests. You pay nothing for this test when you get it from a laboratory, pharmacy, doctor, or hospital, and when Medicare covers this test in your local area. Medicare Advantage plans cannot charge a copayment, deductible, or coinsurance for clinical lab tests to detect or diagnose COVID-19. Medicare Part B also covers COVID-19 antibody tests. You pay nothing for this test. This FDA-authorized test helps to see if you've developed an immune response and may not be an immediate risk of COVID-19 reinfection. Once the FDA has approved and authorized the COVID-19 vaccine, it will be added to the list of preventative vaccines that are covered under Medicare Part B without coinsurance or deductible pursuant to the CARES Act. I like to emphasize that the COVID-19 vaccine will be available to everyone for free, regardless of their coverage status. While I have you guys, I'd also like to share that on Friday, November 6th, CMS released the 2021 premiums, deductibles, and coinsurance amounts for Medicare Part A and Part B. Each year they are adjusted according to the Social Security Act. The standard monthly premiums and annual deductibles are higher than the 2020 amount. The standard monthly premium for Medicare Part B next year will be $148.50. This is an increase of $3.90 from last year, or this current 2020, $144.60. The annual deductible for all Medicare Part B beneficiaries would be $203 in 2021. This is an increase of $5 from the $198 you paid in 2020. Again, I would love to stress that Medicare Open Enrollment will run through this Monday, December the 7th. After December 7th, most people with Medicare will have to wait until next year's open enrollment period to review coverage options in Medicare. This is why we strongly encourage people with Medicare to review their coverage right now and see if they can find a better value. Even if you're happy with your current coverage, it might be in your best interest to do the research. Please visit medicare.gov/plan-compare to shop for and compare health and drug plans that meet your needs. Visit medicare.gov to find and compare doctors, hospitals, nursing homes, and other healthcare services near you. You can get contact information, quality ratings, and other information in a centralized location. As mentioned earlier today, protect yourself by protecting your Medicare card. During open enrollment, con artists may try to steal your identity and commit Medicare fraud. Medicare has taken actions to make Medicare cards safer by replacing Social Security numbers with a more secure ID number. Guard your Medicare card like it's a credit card. Don't give your Medicare card or number to anyone except your doctor or people who you know should have it. If you get a call from people promising you things, if you give them your Medicare number, don't do it. This is a common Medicare scam. Refuse any offer of money or gifts for free medical care. When you get your Medicare statement, look out for items and services that are not correct. Medicare will only call you in these two situations. A Medicare health plan or drug plan can call you if you're already a member, and a customer service representative will call you from 1-800-Medicare only if you've called us and you left a message or you've spoken to a representative and that representative said they will give you a call back. These are the only two times you'll get a call directly from Medicare. If you suspect fraud, call 1-800-Medicare. That's 1-800-633-4227. Again, 1-800-633-4227. TTY users can call 1-877-486-2048. Again, that's 877-486-2048. Also, we at the CMS Atlanta Regional Office are always here to assist you with any matter. Our general email address is roatlhsq@cms.hhs.gov. Again, that's roatlhsq@cms.hhs.gov. And my personal email address is sherrod.mackey@cms.hhs.gov. That's SHERARD.MCKIE@cms.hhs.gov. Let me get that again. It's SHERARD.MCKIE@cms.hhs.gov. I can also be reached directly at area code 404-562-7902. Again, that's 404-562-7902. We want to be available to you guys for any questions or issues you may have. Again, thank you to Congresswoman Macbeth for this opportunity and you all for the time today. Please stay safe and encouraged.
Sherrod, thank you so much for that great presentation. And now I believe we have time just for a few questions from our audience. Again, if you would like to ask a question, please press *3 to submit your question.
Well, thank you, Congresswoman. As a reminder to our audience, again, if you'd like to ask a question, press *3. And if you'd like to subscribe to the Congresswoman's newsletter, please press *6. Our first question is for you, Congresswoman Macbeth. It comes from one of our online submissions. And the question is, I turned 65 this year and I'm having trouble getting in touch with the Medicare office to verify my benefits. How can your office help with getting those benefits?
Well, thank you for that question. And, it's really vital that you get the benefits that you deserve. And that's why I have placed such a big emphasis on my casework team, making sure that we can answer all of your questions and direct you where you need to go. And so my office would be happy to assist you with this issue. And I've got a dedicated team of caseworkers who work with you and also work with Medicare to get the assistance that you need. So just please give us a call. You can call my office at 470-773-6330, and we will work with you to submit an inquiry into the matter that you're concerned about. But if you'd rather, you can also email us if you prefer to do that, and you can email us at casework.macbeth@mail.house.gov. Thank you for the question.
Thank you, Congresswoman. Our next question comes from Linda from Atlanta. Linda has a question for CMS regarding Medicare Advantage plans as a retired federal employee. Linda, you are now live. Hi, Linda. You're live and you're free to ask your question.
I'm sorry, I was on mute. Yes, I'm a retired federal employee, and I was told that I should never give up my federal employee health benefits. And so that I think that meant that I had to always take regular Medicare. But I'm interested in several of the Medicare Advantage plans. And so I'm wondering how I can do that without giving up my federal employee health benefit plans.
Hi. Yes. Actually, we recommend you reach out directly to 1-800-Medicare to get more information on that. It's possible to enroll in a Medicare Advantage plan. I can't give you necessarily advice on it, but they'll give you all your options so you can make the best informed decision. But I recommend you reach out to 1-800-Medicare, and it might be a good option for you to attend the webinar with the local SHIP this evening that I spoke of earlier from 6 to 7. You can go on their website and register on that welcome page for that webinar tonight from 6 to 7 p.m., and it'll give you all the information you need to make the best informed decision.
.org.
I'm sorry, I caught the back end of it.
Okay. Is that the mygeorgiacares.org website?
It is, yes, absolutely.
Okay. Thank you.
mygeorgiacares.org. Absolutely.
Thank you.
Linda, thank you so much for your question. Our next question comes from Margie. This question is for Congresswoman McBath. Margie has a question about prescription drug prices. Margie, you are now live with the Congresswoman.
I recently received my new pricing on my prescription drug Part D plan, and I was horrified. Not only did the monthly cost go up by $40, but a essential generic medication I take went up by the tier. So instead of $5 copay, it's now $40 copay. That's a 700% increase. The drug price, prescription drug pricing is out of control. What can you do as our Congressperson to start to rein in and regulate prescription drug pricing, which affects not only seniors, but other people who need to take prescription drugs?
Hi, Margie. Thank you so much for that question. And, and I have to say very quickly, too, I also have glaucoma myself. So, yes, you're right. It doesn't only affect seniors, but it affects, and, prescription drug prices affect everyone. I actually have to pay about every 30 days $165 for a additive and preservative-free eye drop that I have to put in my eyes twice a day. And, of course, there is no generic for it. And so with a coupon, that's the cheapest that I can get it is $165, every 30 days. So I understand. And I know that this pandemic has shown us that every American needs access to quality, affordable health care. And also, too, I'm a 2-time breast cancer survivor, so I live with a pre-existing condition every single day. And I know that within our district alone, we've got 300,000 people that are living with one as well. And as I've always said, and I've always championed for protecting those with pre-existing conditions and ensuring that every American has access to quality, affordable health care. I think that is absolutely your right. And I was proud in Washington to vote to pass the Patient Protection and Affordable Care Act Enhancement Act. It actually protects those like us with pre-existing conditions. And it lowers the cost of our prescription drugs, and it makes healthcare far more accessible and affordable for our hardworking families. The bill significantly increases the ACA's affordability subsidies to cover more hardworking families. And really, for the first time, no person would have to pay more than 8.5% of their income for a benchmark silver plan in the ACA marketplaces. It also delivers the power to negotiate lower drug prices to the American people, which I know in Washington we're doing all of the time because there's no reason that any American family should have to pay more for the same medicine than those who buy that same medicine overseas. But also during my time in Congress, healthcare has been a top priority for me. Last December, I introduced the Medicare Hearing Act of 2019, which provides coverage for hearing aids and services for seniors. Now, we've just got to continue to find ways to work together to lower the cost of healthcare and prescription drugs for our American families and ensure that everyone has access to quality and affordable healthcare. As I said, that is not a privilege for anyone in the United States. I truly believe that is our right. And thank you for the question.
Margie, thank you so much for your question. We have a question from online for Seth at AARP. This question is, I'm trying to enroll in Medicare, but I'm afraid of online fraud. How can I make sure that I'm doing the right thing?
Yeah, that's a great question, and it's great to be suspicious. I always tell people, you be the detective. The first thing is, if you're enrolling for the first time, to go to the trusted websites, so the Medicare.gov, look for those local SHIP counselors, those local resources that you know and can trust. If you're looking to change from one plan or the other, just make sure that go to a trusted internet search engine and search up those companies. Really right now, folks on Medicare are in the same boat as people looking for holiday deals. They're being bombarded with so much advertising that it's hard to tell what's real and what's not. So I always recommend just start at the source. So go to the trusted website of the company that you might be interested in, and start there to look for contact information. And that's another important thing to look at. A lot of these scam websites, they don't really have real contact information, or they'll have an email address to Yahoo or to Google. Well, a customer service representative from a reputable healthcare company is not going to have a Yahoo address on their website, so that's another red flag to look for. But yeah, I always say just start at the most trusted source you can find, and then go from there.
Thank you so much, Seth. We've got a quick question from Denise from Cobb County. Denise has a question for Gerard, just to get some additional contact information that he mentioned early in his presentation. And Denise, you are live.
Okay, thank you. What I wanted, but I think I heard him answer the question to someone, is that I wanted his full name and address, and I wanted his phone number, because I'm a baby boomer, and going online is my worst enemy. It is not user-friendly to me, and I'm always tripping up, so I can be one of those people that go on something that's legit and get into something that is not legit. So I like talking, and that's the problem today. Yeah, I like speaking to someone. I call the authentic number and to speak with someone and get information instead of going online to get that. So can I please get his information so I can call and get information from his office or him? And I had another question. I hung up, but I had a question for the Congresswoman concerning the ACA. So I don't know if I can still get that answer. Go ahead, please. Give me your name and address. Spell your full name.
Sure, absolutely. It's Sherard, Sherard, last name McKie. And I understand your hesitancy with the website, so it's a few numbers I'm going to give you. The first one is to 1-800-Medicare, and that's 1-800-633-4227. The second number I'm going to give you is to the State Health Insurance Assistance Program here in Georgia. It's Georgia Cares. Their number is 866-552-8255. 4464. And to schedule an appointment to speak with a rep, just do option 4. Again, 1-800-Medicare, 633-4227. The SHIP Georgia Cares, 1-866-552-4464, and it's option 4. Again, my name is Sherrod Mackey. If you decide to email me, it's Sherrod, SHERARD .MCKIE @cms.hhs.gov. And my direct number is area code 404-562-7902.
Thank you so much,
We're
Sherrod.
happy to help.
We have another question for Congresswoman McBath. Congresswoman, this question is from Bill from Johns Creek concerning scam phone calls. Bill, you are live with the Congresswoman and can go ahead and ask your question.
Congresswoman, first of all, thank you so much for everything you do, and we just appreciate just mentioning COVID. Unfortunately, my father-in-law passed away from it, so I get dozens and dozens of spam calls or scam calls on both my cell phone and my home number, and many of these sound legit, and they're obviously fraud. We're both signed up for the Do Not Call list, but we still keep on getting more and more. What can you do, or what can we do to avoid these incessant calls, which we get from 8 in the morning to like 10 at night, from scammers on both the cell phones and the home calls? And is there anything, since this is a federal thing, that you can do to stop all of these calls, these spam calls?
Well, thank you so much for that question, Bill. And I do offer you my deepest condolences. I'm so, so sorry. It's just painful to hear, we're losing people left and right. And I just really do offer you my deepest condolences. And we'll continue to work as hard as we can in Washington to make sure that we're really trying to keep everyone as safe as we possibly can. And thank you for your question. Yes, I get those calls all the time, too. And, yes, I have signed every do not call list unimaginable, and I'm still getting them on my cell phone in particular. But we are working in Congress to stop scam and robocalls. Last Congress, we actually worked to pass the Telephone Robocall Abuse Criminal Enforcement and Deterrence Act. It's actually TRACE, it's the acronym, which actually makes it easier to avoid these types of calls, and it strengthens enforcement against people who perpetrate these unlawful calls. And so, I look forward to continuing to work with my colleagues to fight against robocallers and keep all of us safe from fraud and scams. But just as quickly as we're working and putting these policies and systems in place, people that are making these kinds of fraudulent calls and everything, they're finding new ways to circumvent what's being done. And so, of course, with technology, they're always having to create, as we've heard, from our experts today, create new ways to make sure that we're protecting consumers and protecting individuals. But we'll continue to work as hard as we can. And I understand unequivocally how you feel, because I'm still getting those kinds of calls myself today. And thank you for your question.
Thank you very much, Congresswoman.
Well, everyone, thank you so much for all of your really thoughtful questions. If you didn't get a chance to ask your question today, please don't hesitate to reach out to our district office by calling 470-773-6330. And at this time, I'd like to hand things back over to Congresswoman McBath for some closing remarks.
Well, thank you, Adam. And I always say that I wish we had so much more time, because so many of you have just, amazing questions and really relevant questions. And we'll continue to make sure that we're providing as much resource and information to you. But I do want to take just one more opportunity to thank our guests from CMS and AARP, Sherrod, Seth, and Hillary. Thank you so much for your dedication and devotion to the work that you do to serve seniors in Georgia. I am myself 60 years old, so I'm paying attention and listening to everything that you say and everything that you provide for us, because I, too, will be joining the ranks of some of our constituents that are on the phone with us today and making those decisions as well. But we are so lucky to have you both with us this morning. Thank you for everything. And everyone that is listening this morning, I hope that we've been able to provide enough information for you. And I hope that you've learned enough. But, of course, please make sure that you connect with our guests for additional resources. For those of you who joined us this morning, I hope that you found our experts' presentations informative and very engaging. And that's our goal, to make sure that everyone's questions are answered. So even if we didn't get to your question this morning, or you discover that you have, an additional question later on, just please don't hesitate to reach out to my office. I have a dedicated team who's ready to help answer any questions that you have about the topics that we touched on today and any other federal issue or question that you have. Additionally, if you require casework assistance with your Medicare or Medicaid benefits that we discussed today, or any federal agency, please call or email my office. We are here to serve you. We are your public servants. So the phone number for my Sandy Springs District Office is 470-773-6330. And our email is casework.mcbath@mail.house.gov. Let me read that again for you, so because I made a mistake. It's casework.mcbath@mail.house.gov. Again, the phone number to our Sandy Springs office is 470-773-6330. And the email is casework.mcbath@mail.house.gov. Thank you again, everyone, for your engagement with my office. It's an extraordinary honor and privilege to represent you in Congress. And in the weeks to come, I pray that you all remain healthy and safe. Please do everything that you can to take those precautions and keep yourself safe. And always, please don't hesitate to contact our office at any time. Take care. God bless you all, and happy holidays.